my name is Michelle Day. I'm the CAO manager of the Porcupine Hill Seniors Foundation, but I want to give you a little bit of history of where I've come from and why I'm here today in regards to health. Because in my profession, I've been dealing with the last 10 years with health and housing, and this new whole ideology of aging in place, and is it right, and the whole housing continuum. And right now what I'm seeing in the last 10 years is the whole housing continuing for seniors and aging in place is not being properly met. And there's been a lot of changes and confusion. So in 2002, the Chinook Health Region came out with a document called Charting the Course, saying that 20% of people would be in long-term care as they age, 40% would be enhanced living, and 40% being designated assisted living. And in the Chinook Health Region at that time was being ran by Pam Wicknack and Donna Stalmahovich. So everyone in society thought, well, what is designated assisted living? What is long-term care? What's happening with long-term care? And how I became active is I was a PCA on the front line. I was working both in long-term care and in designated assisted living, and I saw a lot of flaws happening on the front line. Now, the Auditor General, Fred Dunn, came out and did a whole research on what was happening, and this was it. Privatization of housing was taking over Alberta, offering some health services. And the health region, the Chinook Health Region, thought, this is wonderful. What a concept. Aging in place, but there was no standards. They were taking out of the Nursing Home Act, and they were charging seniors and people up the wazoo for those health services. What a great way to make a good buck. Then they thought, well, let's capitalize even more and have cookie cutter lodges and everything across Alberta. And people did not know what to ask for. They didn't know where to go. They didn't know how to qualify, and you heard they didn't know what the rules were when they moved their mother in this house, and then they're moving all over the place, not aging in place. So what happened was the health region thought, well, not only are we going to increase designated assisted living and promote it with videos and question and answer sheets while I was protesting around Alberta, they decided to go one step further and contract out beds from these DALs, and here we go. So what happened is I finished university and I got a job as the CAO manager of the Porcupine Hill Seniors Foundation. It was really interesting because I went from the frontline aspect to the management aspect of that. And I am a publicly funded lodge, and we are for the well elderly. We have a mandate that we want to provide housing for well elderly. But this is what I faced with health. Now, as a publicly funded lodge ran by elected officials in a foundation, we have to deal with 4 to 5 ministries. I have to deal with health. I have to deal with Alberta Seniors and Community Supports. I have to deal with Alberta Infrastructure. And I have to deal with Housing and Urban Affairs. Now, when I go to these conventions and try to talk to all of them at the same time, good luck. No one will talk to you from all the ministries at the same time. But what's happening was all these DALs that were popping up, they were getting different contracts with the health region. So the Alberta Senior Citizens Housing Association, which all of these foundations can be a member of, went to the Alberta government and said, we need some consistency. We need to understand what these contracts are. So they came up with the supportive living framework. We now have the accommodation standards to kind of monitor what these different level of care facilities and what different levels are. So Alberta Senior Citizens Housing Association went and they did a research paper. Now anybody here can go online and see it. It's at the Alberta Senior Citizens Housing Association, and it's called the FASL, the Formal Agreement Supportive Living. So they studied 7 health regions. Each supportive living facility had like different contracts. It was all over the place. No templates, no same anything. It was a mess. So that's what the designated assisted living is at right now. A mess with all these different contracts, with all these different housing individuals across Alberta. So as a lodge, I sit there, I say, well, long-term care is closing. The health region is now saying, well, no, not 40% will be in designated assisted living, 60% will now, and we'll close long-term care because everyone can happily age in place under designated assisted living. My problem is now, especially in rural Alberta, what's happening is I want to be for the well elderly, but now I have the health region knocking on my door going, well, no, 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 no. We need you to take more of the the health services now. And I said, well, but there's long-term care, there's this. No, 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 no. We're actually going to start holding some of your public funds unless you're going to show us that you're going to increase your health services. And I sit there and go, well, wait a minute. What? Sorry, 1 minute. So I sit there and I look at the health region and go, wait a minute, wait a minute. Why are you doing that? Why can we not have a lodge for well elder people? I understand aging in place, but you've cut off long-term care now, and now you want to get rid of lodges. And lodges serve a very important role in society because we want you, the seniors, to be looked after, and we want to keep them well fed and nourished. We want to provide them with recreation. We want to give them a place where if their loved one, spouse dies, that they're with other people. But what's happening in Lethbridge, the Chinook Health Region, is now that people are skipping lodges entirely and going to DAL. In crisis mode, because they've been shoved into a hospital, they have nowhere else to go. Long-term's closed, we're going to put you in DAL. But by then, it's too late. And there's still that confusion of what health services are there. So all I have to say is Donna Stamahovich and Pam Wicknick, now on the Super Board, are saying that lodges are an untapped resource. An untapped resource is that they would like us to take on that health care role. We're housing, we're not health, and we need that just as much as we need long-term care.